Thanks very much for being on the webinar, and an official welcome to our webinar to talk about the openings for fitness centers, bars, hotels, art galleries, and schools. And really appreciate you being with us this morning. And you know, many of you have been waiting a very long time, we know, for this moment to come when you can finally reopen. And we're excited along with you that you are able to reopen. And really the purpose of what we're going to cover in this call in the next hour here is to go over what the new requirements are for reopening, and both from the state and the county level. We'll go through what they've come up with so that you can open your establishment safely for yourself and for your employees and for your customers, and also to be in full compliance. So our goal today is to share the information that you need to be able to do that, and of course to answer any questions that you have. We are here for you. We don't want to just be presenting the whole time. If you have questions, feel free to speak up or enter your question in the chat, and we'll be monitoring that because our main thing here is to get you the information that you're looking for. So with that, I just want to introduce myself. I'm Tim Murrill. I'm the director of the Solano Small Business Development Center, and really happy to partner this morning with Heather Henry. Heather is the president and executive director of the Workforce Development Board for Solano County. There she is. And man, Heather has become our resident expert on all things opening and compliance. Believe it or not, this is the 12th one of these webinars that we've done as the different business segments have opened back up. So if you're not a fitness center or bar, hotel, or gallery today, but you still have questions, we're happy to do our best to answer those for you this morning. I also want to thank Annette Taylor. I see that Annette's on with the city of Vallejo for partnering with us and bringing this to you, and also for James Cooper, not sure if he's on or not, but with the Vallejo Chamber. Vallejo, between the Chamber and the City Economic Development Department, you guys have done such a great job of supporting your small businesses, and we just want to recognize you for that, and appreciate your willingness to kind of co-partner with us in bringing this webinar on today. So there she is. Hi, Annette. Well, cool. So what I wanted to do, I'm sorry, what was that?
May I add something to that?
Please do.
We also have a number of resource partners on as well. Visit Vallejo is with us. I know that the Hispanic Chamber is with us.
Awesome.
Leah, thank you. And also Brooke Fox from Vacaville. Brooke, is it downtown Vacaville?
Yep, the downtown Vacaville Business Improvement District. Good morning.
Awesome.
I got a lot of sun this weekend, so I'm not going to show you my video image. I'm taking a pause on that.
Oh, come on.
Okay, I'll wave hi.
Oh, there you go. Way to go.
Hey, running the farmer's market.
I saw your Facebook post on that, Brett.
Yeah.
Well, hey, you got a good dose of vitamin D this week, right?
Did.
Good for you. Thanks so much for being on.
Yeah.
Yes. Thank you for that, Heather. Thank you, Leo. Good to have you on, man. The Hispanic Chamber. And well, cool. So what I want to do is just spend a couple of minutes to kick this off and talk a little bit about the business part of this and some planning things, and then I'm going to turn it over to Heather to go through the guidance piece. So Heather, if you don't mind, if you could go ahead and pull up our slide deck for this morning. I think as you get ready to open up, we know that you have a very full plate and many things to do to welcome in your customers again. And one of the things, though, that we want to talk about is you have a lot of urgent things going on they're on your list, but I want to maybe spend a minute talking about those things that are maybe not urgent, but very important. And they revolve around doing some planning on the business management side of things. So the first thing I would mention there is that you really do need a plan for reopening. All of the criteria and protocols that we're going to be going through this morning. You really do need a list of who, what, where, when is going to get all of these steps implemented. And that's obviously very important, and that's I'm sure what's on your mind very much today, or has been for the last few days. The next item on the planning perspective is to do some what we call scenario planning, and what I mean by that specifically is the fact that none of us really know what's going to happen in the next 3, 6, 9 months ahead as it relates to COVID. There's a very real possibility, as I'm sure we've all heard, that this thing could produce a second wave. And I would just say that as a business owner, that the time to plan for that as a possibility is now. Putting together a plan of how will you handle things like staffing and your budgeting and your communication plan, and really just managing the finances as well if another shelter in place does happen. Hopefully it won't, but it'd be better to be prepared for that, as prepared as possible. The other thing for planning and putting into action, I think right away, is around the marketing of your business. And this is a great time to market, because people have been waiting for you to reopen. They want to know that that you're there. They want to know what your hours are. So at the very least, you would want to market the fact that your doors are open, and what those hours are, and make sure to hit that in everywhere that you have an online presence for starters, be it your website, be it your Google business page, your Facebook page, wherever you normally do your marketing and have an online presence. You want to make sure to let them know that you're open. And another really good thing right now to include in your marketing message is the fact that you are compliant with all of the health department and state and county requirements, and that you've gone above and beyond in making sure that your establishment is a safe place for customers to come back to. Some folks are still going to be a little bit reluctant, so I think providing that assurance that you've been on webinars, you've studied what the requirements are, that you've put those things into place, is a really important message right now. Another part of that plan is budgeting. And we realize it's going to be a little difficult to understand what your revenue flow is going to be, especially over the next couple of months as you reopen. But rather than just sort of seeing what's going to happen and adjusting to the moment, it's really important to have a written budget where you can do, to the best of your ability, some forecasting of what you believe the revenue is going to be. And that might be adjusted like every week or two, right? You may set your whatever your forecast is. And also on the other side of the ledger, you need to have a budget, expenses that are supportive of that. So staffing obviously is a major component. So how will you adjust your staffing to ensure that to the best of your ability that you can operate in the black financially. So just a couple of of things to remember with planning, and to actually help with that, I want to talk a little bit about the resources. If you go to our website, which is solanoSBDC.org, At the top right, when you get into our website, you'll see a button that says COVID Recovery. If you click there, you're going to find a number of different resources available to you. One of the things that's there is an action plan template. And really, that is a Word document that we've created that has all of these components of planning in it that I just briefly reviewed. So there's a sort of a structure there for you to create your own plan if that would be helpful for you. Another thing that's there is another list of recorded webinars. We did a few weeks ago, we did a webinar series that's called What's Next, that talks about all of these components in more detail, the scenario planning, the marketing, and the budgeting. So, if you have some time, I encourage you to check those videos out because I think there's some helpful information there. And the other thing I wanted to mention to you is that while you're on our website, when you first sign in, there is a big red button that says Apply Now. And you may wonder what you're applying for. You can apply to become an SBDC client. And as an SBDC client, you have access to all of our training webinars and training classes. We're actually going to be opening back up real live in-person training classes, we hope, in the next month. And so you have access to that, but you also have access to one-on-one advising. We have an awesome team of 15 highly experienced business advisors that are available to work with you to develop your reopening plan or develop your strategy for the next 6 months, 12 months. We've always had this resource, or maybe not always, but for the last several years, we've had this resource available in Solano County. We've become, I think, an even more important resource, and we encourage you to reach out to us to become a client, and we'll get you assigned to an advisor that would love to help you in your business. I also want to mention a few other resources from our partner that actually is our wonderful host here in Solano County, which is the Workforce Development Board. There are a couple of programs I want to mention to you. One is a program called the Layoff Aversion Fund. We call it LOAF for short. That's a place where you can, or a program that you can apply for to help you with anything related to keeping your business up and going so that you don't have to lay people off. And that could include PPE items. It could include technology, software to help with telecommuting if you want some of your employees to telecommute. But really, there's kind of no, you can use your imagination. If it's something that's going to help you to keep you from having to lay people off, that's what that fund is for. And we still have some funds available for that. And by the way, the place to go to apply for that is the website, which is solanoemployment.org. And there are other programs as well. We have an on-the-job training program that provides some assistance with salaries for new employees that you would bring on. We also have a program that can pay for employee training that's available from the Workforce Development Board. So lots of really great resources. So I encourage you to check those things out. And just know, again, that between the Workforce Development Board and the SBDC, we are here to help you, to get back to thriving, right? Which is what you want and what we want for all of you. So with that, I am going to now turn it over to Heather to walk us through the compliance piece. Heather?
Good morning, everyone. So we do have a wide variety of businesses on the call. If you have not already, please go ahead and put in the chat your business and what type of business that you are, so we can make sure that we are adjusting based off of what your particular needs are. The other thing that I want to highlight before we get started is that in the chat, this PowerPoint is in the chat for you to be able to download and to use as a reference. And then also the latest Solano County Health Order that was released on the 12th. So those are both things that are in the chat for you to be able to download. Okay. All right. So I'm going to move your lovely face. There we go. All right, so this is kind of the roadmap for reopening. And one thing that you might notice is that there's both a state reopening guidance and there's county reopening guidance. And so the first orders came out on May 7th, I believe at this point, and the county organized it into levels of risk of transmission. So low risk, medium risk, high risk. The state organized their reopening by industry. So this kind of helps you see what those two look like together. We are currently in stage 3, kind of the early pieces of stage 3. So our limited services are open, our retail and offices are open. We are currently in this, most of the things in stage 3 are open, but there are still some pieces that are not. And kind of what categorizes stage 3 is, well, stage 2 and kind of the low risk is where you're going to be able to have social distance easily between yourself and patrons and among patrons. Stage 3, which is now where we're at, is where you're either going to have more direct contact with people, you're going to be more physically close with people, or you're going to have large groups of people. And so that's where we are right now, and how to kind of make sure that we're reopening while also making sure that we're being as safe as possible. And then stage 4, which equates to the county's high risk, is really where you're going to have large groups of people that are not from the same household. And those are things that are still not open yet, okay? So what this means is this is kind of a list of where we are right now and what can resume and what can't resume. So the latest group of reopening all happened as of June 12th, and that includes day camps in local parks, family entertainment centers, fitness centers, hotels now for tourism, movie theaters, museums, galleries, and then wagering facilities and racetracks. So those are the new group of businesses and industries that are open as of the 12th. Over the weekend, it is still prohibited, but over the weekend, guidance came out from the state that massage and bodywork and nail salons will be allowed as of June 19th. So the state has put out their guidance. The county is still working on their guidance for that, okay? And then still to be determined are going to be convention and event centers, demonstrations. So like say you do magic demonstrations or live animal demonstrations where you can't have that social distancing, that is still not allowed. Ice rinks, roller rinks, laser tag, that's still not allowed either, because the idea behind that is that you're going to have a large group of people in a small area and they're not going to be from the same household. So those groups are still not allowed. Another thing to consider is that playgrounds are not allowed. One thing that the state and the county both have really been looking at is that adults are better at maintaining social distancing and reduced contact than children are. And so trying to mitigate that as best as possible. Some pools are allowable, and we'll talk about that, but general public pools are still not allowable. And then anything like theme parks or live audience sports, those are still in stage 4. So I want to pause here for a second. Do you have any questions about what is and isn't allowed to be open? I know that it can get pretty nuanced.
Yes, Heather, this is Leo. Can you hear me?
Hi, Leo.
I wasn't clear in reference to the ordinance of if bars we're allowed to open. Because in the Solano County website, it says wineries, tap, breweries, not specifically the word bar. So
yeah, bars are allowed to be opened, but you'll see as we get further on, there's some activities within bars that are not allowable. So and that's a really good kind of segue. We do all understand that there may be an establishment that has multiple activities at it. And so one thing that you're going to have to think about is, I may be a fitness center, but I also have a pool. I may be a bar, but I also have concerts. I may be a museum, but I also have events and private parties. And so it does require us to kind of separate the activities that are happening within our establishment. And some of those are going to be allowable and some of those are not. But that's an excellent question. And that is further down. We'll talk about that in a little more detail. Any other questions about what is or isn't allowable at this point? Okay. All right, and both the state and the county also recognize that not every business fits into these categories neatly. And so find the one that you feel is closest to you and go with that. Okay. All right. So in general, there are kind of 4 categories of reopening. Late Friday, the county redid their roadmap to recovery, their reopening page, and it is very user-friendly right now. So I would definitely take an opportunity to go to that. They have kind of categorized which industries can be open, and then for each of those categories, they have both the state guidance and the county guidance connected to it. So that's a really good resource as you're going through this to be able to look at those requirements, okay? But in general, and the state and the county kind of organize this slightly differently, but all of the content is the same. So the 4 major things to think about are signage, employee considerations and how to keep them safe, social distancing and how to reduce contact as much as possible, and then sanitation. And so what we'll do is we'll go through each of these in more detail. Just because we have a wide smattering of industries, I'm going to give you a lot of references, but we'll not go through each of those specific pieces. Okay? All right, and feel free as we go through to stop me at any point. Okay, so signage. There are 2 kind of areas of signage. One is the signage for your public and the other is the signage for your employees. So what must be posted at your public entrance is something around the social distancing protocol. And over the past couple of weeks, this has gotten a little more complicated. So if you are purely what the county calls a low risk business, then the social distancing protocol that the county put out is what you want to use. However, over the past couple of weeks, as the state has come out with new guidance, they've changed that a little bit. So restaurants and bars, the museums, hotels, pools, if you have a pool, and then hair salons are the ones where they want you to use the state's written protocol, and then there is a cover page from the county to attach to that. If you do have a pool, you would do one for your establishment and one for your pool. So those are kind of the general pieces of it. In the way that they have changed this, it used to be that you had to put the whole social distancing protocol on your public entrance, but they've changed that. If you take a look at this sign over here that says we're ready to reopen responsibly, they've now changed it so that you don't have to post your full protocol. You can post just this and then write down who your contact is for your social distance for your different pieces. And then you have to make that full social distancing protocol or written guidance available upon request, either physically or electronically. So that's one change in the past couple of weeks. So you'll see down at the bottom under the free printable signs, I do have a direct link for you to that ready to reopen responsibly, but it's also on the Solano County webpage. So if you do your social distancing protocol, you can then post this, and that's kind of part of what Tim was talking about with the messaging. Hey, we've done all of our pieces in order to be compliant and in order to make sure that you are coming into a safe and sanitized environment. And that's really important to people right now. So that's how that piece works. Are there any questions about the social distancing protocol? Because it has gotten a little tricky in the past couple of weeks. Okay. All right, the other thing that you have to post at your public entrance and then throughout kind of your establishment is something around COVID-19 guidance for your employees and your customers. The kind of high level pieces like stay 6 feet apart, do what the county calls respiratory etiquette, like cover your cough and sneeze, wear a face covering, stay home if you're sick. And those are the general things that both the state and the county want you to just continually remind your patrons of. My suggestion is don't reinvent the wheel. This poster that you see right here is downloadable from the CDC website. So at the bottom, I gave you a couple of places where you can go and you can get some free printable signs. CDC has a number around general COVID, how to stop the spread of germs, some for different types of scenarios. And so that's a really good place to get your general COVID pieces. Solano County also has some as well. And then I also put in here for you signs.com. What they have done during COVID is they've created probably about 50 different signs for businesses, anywhere from we're now reopened to we're doing curbside to wear your face mask, that are all free that you can just download, print, and post. So these are a couple of places you can go to get that signage that you need, okay? And they're all reproducible. So you can laminate them, you can just print them, you can make a poster of them. They're all free of rights for you to be able to use, okay? And then the other thing too that they want you to make sure that you're doing is that whatever social distancing that markings that you're using, and we'll talk about those, to make sure that you're posting reminders to customers to use those social distancing measures that you've put in place, okay? And then from an employee standpoint, wherever your employees are, you must also make sure that you're putting the same guidance for the public in those employee spaces. So in your break room, on your HR wall, wherever it may be. The other thing too that you're gonna wanna post in that location is the Families First Act employee rights. And this is now a requirement. We'll talk a little bit more about the Families First Act, but this is the paid COVID leave and the expanded FMLA that Congress put into place that employees have the right to use. And so it is a Department of Labor requirement to post these employee rights in your facility. And so I gave you a link at the bottom to be able to go directly to that as well. Okay. Are there any questions about signage?
Heather,
Yes.
this is Mike Brown. I may have just not, maybe I had missed it, but I don't see any signage that specifically says something about wearing masks.
Yes, and that's because it's not required in all instances. It is strongly recommended, and so there are certain pieces where employees and patrons must wear face coverings, and we'll go through that in the specific pieces. But businesses do have the right to say face masks are required. And if that is a requirement that you have within your own business, then you would want to post that.
Do you
And
have?
just sorry, Mike.
Oh, I'm sorry.
I'm sorry.
In your mix of printable signs, is there something in there that helps them communicate that message about masks?
Yes, both
great.
CDC and signs.com both have signs regarding face masks.
Okay, great, thank you.
And just to clarify, if your business is in Vallejo, it is required for face masks.
Thank you, Tina. I do appreciate that. Yes,
You're right, it
Vallejo
is.
at this point, I believe, is the only city. I know Benicia has been going back and forth on it, but that's a really good point. If you were in Vallejo, it is required.
Right, and we're sending out letters to all of our business license holders. This is Annette with the city, with a letter and 2 samples of posters that they can put up in their business. So any public, as Tina said, any business that's open to the public is posting the sign is required, is how we're phrasing it.
Annette, would you be willing to put in the chat a link to where they could go to find that once it's posted?
Sure. Right now we're doing the mailing, but yes, I will do that.
Perfect, thank you.
Okay.
She's testing you, Annette.
I know. I am so Zoom. I know. It's like, do I say, I don't know how to do this? I'll do that.
And this is why we partner with our local cities, because there are different city-specific requirements. Thank you. Okay. And Vallejo has done a really good job of kind of posting city-specific things that they're looking for. So that's definitely, if you were operating within Vallejo, make sure that you're keeping up with what's happening with the city of Vallejo on that. And your partners like Visit Vallejo and Vallejo Chamber and Economic Development can make sure that you're staying up to date on that. Okay. All right. So the next kind of category is around employee considerations. So these are the 4 pieces to think about, both from the state and the county perspective. So one thing that is required is training for your staff. And these include things like how to prevent transmission, COVID-19 symptoms and what to do if sick, if you are giving personal protective equipment, how to use those properly. And then any specific protocols that your site is enacting, making sure that your staff is well aware of those. And they do suggest that when you put together your social distancing protocol, that you send that out to all of your staff so that they are fully aware of what those protocols are. Okay. As it relates to sick employees, as part of that training and in your communication with them, definitely inform them not to come to work if sick. Again, CDC has some really good kind of posters and flyers around that. And also, one thing that's in the state guidance is providing screening of employees for symptoms. And this is another kind of back and forth issue like the face masks. You must do some kind of screening for employees of symptoms before they start work. You can do like temperature controls and symptoms check when they come to work. You can also have them do that themselves before they come in, and you provide the guidance for what that looks like. But they do want you to make sure that you are screening employees in one way or another before they are coming to work. Okay. And then if they are exhibiting symptoms at work, you are supposed to send them home. One thing to remember with that is that you are still held to the reporting time pay pieces. So even if they only come for 15 minutes and you send them home, you will still be required to do at least the 2 hours of reporting time pay per state law. Okay. Any questions on those pieces? That screening of employees has kind of been a hidden piece, but it is in all of the state guidance.
Does the screening apply also to volunteers?
Yes.
Thanks.
It does. It's going to be anyone that is coming to do work for you, whether they are employee, contractors, or volunteers. What we have chosen to do is that we have chosen to give the guidance to staff and say, screen before you come to work, and these are the things to pay attention to. If you do screening of employees on site, then you're going to have a number of considerations to think through. You're going to want to make sure that you are providing that protection to the person that's doing the screening. You may need to add more time to an employee's time in order to do that screening. One thing that we have kind of noticed in general is that businesses are kind of put into a situation where they are considering health pieces that they have never considered before, and that's not our expertise. So make the decision that's best for you as to whether or not you want to provide that screening or you want to provide guidance for them to do that screening at home for themselves. Okay. And CDC does have a like a little assessment tool that you can use, and that is linked in the county guidance.
Heather, one of the other pieces that I've heard around HIPAA issues with temperature and stuff like that, employers taking that information. And I think that's part of the reason that some of them are considering having their employees do this screening at home so that they're not caught in that position.
Yes, and just from an employer standpoint ourselves, that was something that we were concerned about. And so we made that decision. Every business is going to have to make that decision for themselves. One thing just in general around these employee considerations is that all of this is so new that there is no case law on it. A lot of these laws and a lot of these requirements and rules that have come out, usually what happens is a law comes out and then you have case law that kind of builds the, you can do this, you can't do that, you'll be in trouble if you do this. And we don't have any of that yet. So my suggestion to you just in general around employee considerations is to think through it strategically and be cautious about the decisions that you make, because the last thing we would want is for one of you guys to be the case law example. Okay. So for protective equipment, there are some specific protective equipment guidelines that we'll go through, but just in general, if you're requiring employees to wear personal protective equipment, you should be providing that for them. If physical barriers, if 6 feet cannot be maintained, they do want you to use physical barriers. And then I know a lot of our businesses today don't have this option as much, but wherever you can, have employees telework just so that you're reducing the number of employees in a particular facility. Okay. And then there are a couple of things around worker rights. So it is important to provide the required leave options. We are starting to see Department of Labor enforcing this piece and back wages being given to employees. So for the COVID leave pieces, employees are entitled to 2 weeks of paid leave related to COVID leave. There are some very specific pieces of what people are allowed to use that for. And then childcare is a big piece of that employers have had kind of challenges in figuring out. So they're either paid 100% at their wages or 2/3 of their wages, depending on what the reasoning is. Childcare is at 2/3. And then if they are unable to work due to childcare, they are entitled to expanded FMLA. The one thing to consider about that, and this applies to any business that has less than 500 employees. Businesses that have less than 50 employees can use an exemption for the child care piece of it. So I would definitely make sure that you read through this and understand this. On solanoemployment.org's website, we do have information about the Families First Act and our frequently asked resources for businesses, which you can find on our general COVID page. The one thing to remember about this is that the federal government is paying for this. So you are required to provide them, but on your quarterly taxes, you can get a dollar for dollar reimbursement on any of the COVID leave that you pay out to employees. Okay. The other thing to pay attention to is that on May 6th, the governor put out an executive order around workers' compensation. Essentially what that says is that while we are under the shelter in place, and that goes for 60 days, so that would go through July 6th. We'll see if that gets extended or not. Under the shelter in place, it is assumed that if an employee contracts COVID-19 and they have been at work in the past 14 days, it's assumed that they got COVID-19 on the job, and therefore they are covered under your workers' comp. Okay, so make sure that you talk to your insurance agent or your HR person around that. So as you're reopening, you're paying attention to those leave options and to the workers' compensation pieces, so that you are ahead and being proactive on these employee rights issues that could cause you issues later. Okay. And then the last general piece is to identify a COVID-19 supervisor or more than one to ensure that these protocols are being met. You must have a COVID-19 supervisor on site at all times that you are open. So if you are open like a general 8 to 5 and one COVID supervisor would be there the entire time, then that's perfectly fine. If you have multiple shifts, you're going to want to identify multiple supervisors. All right. Are there any questions on the employee considerations? Wow, and it's already 10:42. Okay. All right, so there are some specific ones that you can go back and you can take a look at, but in general, some of the things that they want you to do is to think about how your employees congregate, understand that employees are all kinds of in different places with this and may require or request modified duty options so that they can reduce their contact with guests and other employees. And the state and the feds are both encouraging that you work with employees through that piece of it. Okay. Another thing to take a look at looking at the right, particularly if you have groups of people where you are, is to develop a plan for potential of repeated closures. So if say you have a dance studio or you have a day camp and somebody, you find out that somebody that's been in your facility has contracted COVID-19, you should have a plan for potential for closure on that, what that looks like, how you notify the health officers, the sanitation that you may need to do regarding that. So those are some things to definitely think through, and the public health department has been really open to working with businesses through those types of plans. Okay. Any questions on that? And again, this is a lot of reference information and you can download this and go through some of the details. I just want to hit some of the highlights for you. Okay. All right, so the next category is around social distancing and reduced contact. And for the types of businesses that are on today, there is a lot of information around these two pieces to pay attention to. In general, remember 6 feet apart. And where you can't do 6 feet apart, have physical barriers that are protective equipment that's going to be able to protect those individuals. Another general concept is that you're going to need to limit the number of customers and employees. So in almost every single industry guidance, it talks about reducing your maximum occupancy. For theaters, it's 25% or 100 people, whichever is less. And a lot of the other businesses, it's about what's the capacity, what's the occupancy based off 6 feet apart that you could hold. Okay. And it's not necessarily 6 feet apart of individuals, but it's 6 feet apart of households. On the other side, a couple of large concepts to remember is that anything that is a customer self-service item, you should eliminate. So if you have like a coffee station for people, you're going to want to get rid of that. If you have condiments in packages, you're going to want to get rid of that. If you have, I'm not sure what some of the other examples are. Like when you're at a putt-putt golf and you get those scorecards, think through things that are self-service items that people are going to be touching a lot. A bowl of mints, those are all things that can collect transmission. And so those are the things that you're going to want to eliminate, okay? And then the other big piece is to use contactless payment systems as much as you can. You want to reduce cash as much as possible, and you want to reduce things changing hands as much as possible. All right. Okay. So again, there's a lot of reference pieces here. A couple of things to point out. If you are in an indoor space, try and bring in fresh outdoor air as much as possible to keep airflow moving. If you do rent what you do to other people or to other community organizations, anyone that uses your facility, you're going to want to make sure that they are following the guidance that you have set for your facility as well. Okay. I know that we have some fitness groups on, and we have some like museums and stuff like that on. You want to try in general to keep your groups small and to keep them as much as possible groups within the same household. So say, for example, you're doing choreography. You're not going to want to do choreography where you're going to have a lot of contact. You're going to want to do more spaced out choreography. If you have museum tours, you may want to do less tours and do more by household groups, or you may want to do like self-service tours where you're giving them things that they can walk through themselves. Essentially, think through the things that you do, and if you have things that you're going generally have groups of people coming together that are not in the same household, you want to mitigate those. And things where multiple people are touching them or they're frequent touches, you want to mitigate those. So those are kind of the two major things to think through. Where do I have people congregating, and where do I have people with frequent contact? Because the longer people are together and the more contact that you have, the higher that risk of transmission is. And all of the state and local guidance is trying to mitigate that. Okay.
Heather?
Yes.
How does that apply to items that are for sale? For example, in some small galleries and museums, there are items displayed that people would be tempted to touch. Are those now to be removed, or how do we work with that?
No. So if you are selling something, then that's a retail guidance. And so if you have like a shop in your gallery or in whatever kind of establishment that you have, also take a look at the retail. My one suggestion for you is that if you have children that are coming through that, I mean, I have 2 little kids myself, they touch everything all the time. And so you may want to move them up, but you don't have to remove them. It's more like self-service items that are not for sale or the things to pay attention to.
Heather, can I ask a question? This is Whitney Bain. I'm with Cuban Rhythm and Rumba. It's a dance studio. We have areas like a built-in seating area. It's like a big bench built into the studio. And I'm wondering for areas that would be open for public seating, is there restrictions for that? Should we be blocking that off or somehow trying to see if we can get that removed?
I don't think you have to remove it. They do talk about, and I think it's on the next one, that you want to space the chairs as much as you can so that you have that 6 feet. Benches you can't space out, right? But you can say that this bench is reserved for families, for example, so that a whole family can sit together. So that's kind of a way to still use that, but to make sure that you're not putting people from cross households into one area. And that's something to really pay attention to if you have like dance studios or fitness groups, because you will have families coming in and you will have parents coming in. And as much as you can, you want them to drop people off instead of sitting there and waiting. They talk about in restaurants encouraging people to wait in their cars. You could ask parents to do the same thing. So you can have families sitting together or households sitting together, but you do want to separate anything else. Does that answer
Heather,
your question?
It does. Thank you so much.
You're welcome.
Heather, this is Mike Brown. We operate, well, of course, it's closed right now, the visitor center in the Vallejo Ferry Terminal, and we have a big, huge rack of all kinds of brochures from our members and all that. Is that something that they can't have access to?
So that's a really good question. I think I went through the main pieces of this. So this slide talks about, and you'll see here, like to remove seats to have that distancing as much as possible. I think it's on my next one. One thing about, Mike, I'm going to get right to you, but I know we had a question from the bar standpoint. This has some of the bar considerations on it. If you are a bar, you're not going to want to do like drinking game night. Or trivia night, those types of things where you are encouraging movement and shared pieces between guests, karaoke, open mic, trivia activities. drinking games or contests, dance floors and performances should not be used right now. So think of yourself as purely a bar without entertainment is the way that you're gonna have to go about it, unfortunately. And one thing that they do also encourage, and I'll leave it up to you to figure out how this would work in a bar setting, is they do suggest that you try and limit how much people drink, because as people drink more, they tend to think less about compliance type issues. I'll put it that way, okay? So Mike, going to your piece, the other kind of thing, two things to think about too, is that if you have any activities that are not core, like a spa or family programming or food service, if you have things that are not core to your business making money essentially, then consider suspending those. Another thing that you can do just from a marketing standpoint and to help reduce the transmission pieces is to consider special hours for high risk or medically vulnerable populations, and do that at the beginning after you've done all of your sanitation pieces. That can both reduce their transmission and be a potentially good way to market your services for those that are vulnerable. Okay, same goes for campers. So if you are going to be doing a day camp, think about all of those different pieces and what kids may be high risk potentially. Okay, but in general, anything that is a group sport, you're not going to be able to do right now. So intramural activities, group sporting events, those types of things where you're going to have cross households are not allowable at this point. All right, so Mike, this is where we answer your question. And this applies to museums and stuff too. So their suggestion is to provide disposable or single-use pamphlets, maps, anything that you're going to be sharing. They do suggest that you don't use things like racks. Maybe you have them at your desk and you hand them out upon request, or maybe you have a sample of one and say ask at the front for a copy of it. But anything where you're going to have kind of those like magazine racks and those types of things, those are areas that are going to congregate transmission. So you want to discourage those, but I also understand, particularly like a Visit Vallejo type scenario, maybe you put out samples and say ask for a copy at the desk. Okay. In general, you want to avoid sharing equipment among employees, among patrons, things like pens. If you use the audio headsets and tour pieces, if you have public drinking water fountains, if you have like the kiosk touch screens, anything that is going to have repeated contact, you have two choices. Either one, discontinue them or avoid sharing them, or two, disinfect them after every use. And those are going to be really your two options for anything that is going to be touched multiple times. All right. And this goes into a little more detail about them, but that's essentially the crux of it. If things are going to be touched multiple times, either discontinue them, or if they are an integral part of what you do, disinfect them regularly. Any questions on these pieces? And Tim, I see we have some chat. Are those questions?
They're yeah, so far I've been able to handle.
Okay,
yeah.
Perfect. If you do have a snack bar, for example, one thing that they do suggest, and it's kind of across different industries, is think of selling pre-packed or individually wrapped foods. Again, the main thing is just take a look at your establishment with new eyes. Take a look at, do I have congregations of people? Do I have things that are touched multiple times? And if you can think through those two pieces, that's what's really the crux of the guidance. How do you mitigate those two pieces? Separate people or use protective equipment, or when it relates to things that are touched, either discontinue them or sanitize them like crazy.
Heather, I have a quick question. This is Joyce Mitchell. I own a fitness studio.
Yeah.
Going back to food, I was thinking of, and would this be okay, getting cake pops that are made by Nugget. They're already wrapped in a little goodie bag, like as a thank you for clients sticking with me throughout the quarantine. You know, those clients that have been training with me remotely and have stuck with me. I have a little sticker I was gonna give out, but I thought that including a yummy cake pop from Nugget in a little bag would be okay. Is that okay since I didn't make it, or is that still no?
No, I think that's okay. And in the restaurant guidance, how they deal with silverware is probably a good comparison to that. They say pre-wrap the napkin rolls and the silverware and put them in a bin that has been disinfected, and minimize how many people are touching that. So you can use that and kind of apply that here. If you're going to be putting stickers and stuff together, make sure that you've washed your hands, make sure that you have minimal people that are creating those, and then put them in a place that is disinfected and that's not going to be touched. And then instead of having them grab them, I would give it to them.
Okay.
So as long as you kind of mitigate some of those pieces, I think it's fine.
Okay, thank you.
You're welcome. Any other questions around kind of reduced contact and your particular scenario? Okay, so there's one more piece that I want to go through. One thing just in general around this, when it comes to arrivals and departures, you're going to want to think, because the types of establishments that you have, you're going to have multiple people coming in, right? So if you can stagger those appointments, if you can do some kind of virtual check-in, if you can designate entry and exit routes, if you do have a hotel or a lodging, provide time in between so that you can do that cleaning. So if you have a large group of people coming into your facility, think about how they come in and how they leave. Okay, and then here are some pieces that you can go back and you can take a look at. All right, the other thing that is very specific are pools. So if you have a pool, nothing that has sauna, steam rooms, or hot tubs, nothing that makes people sweat is the way that I read it. And you're really going to want to make sure that you're cleaning it properly and that you are thinking through the social distancing both outside of the pool and inside of the pool. Solano County added that you must have some kind of monitored appointment system for pools. So if you are an apartment complex with a pool and you don't tend to manage it, you just let people do it, you're going to have to rethink that and have somebody there that can make sure that these protocols are enacted. Okay, and it's 11 o'clock, so the last little piece is around sanitation. These are the 4 major buckets around sanitation. If you have not been open yet, you're going to want to do a full sanitation. The latest thing that they've added is that if you have water, like a large, like a pool or like a public water fountain, to pay attention to the fact that water that's been standing for months can carry diseases. And so there's some disinfecting pieces and some things to think about around that. But CDC has a really good and easy to use disinfecting tool for reopening that I would check out if you haven't opened yet. Okay, once you do open, make sure that you are cleaning routinely. Again, anything that's high touch or that's a common area, and sanitize like crazy. You may need to assign cleaning tasks to employees, have a company do more cleaning for you. And those are things that we didn't think about before COVID and didn't plan for before COVID. But you're going to want to establish some kind of cleaning schedule. And my suggestion to you is to let the public know what that cleaning schedule is so that they feel safe. The other general thing to look at is to provide sanitation options for those that are coming in. If you're a fitness center, put disinfecting wipes next to everything. Where people are coming in high traffic areas or checkout counters or retail sections, put out hand sanitizer and disinfecting wipes. It will make your patrons feel safer and encourage them to use them. Okay. There are a couple of reference slides for specific industries after this that you can take a look at, but that in general is the guidance from a state and a county perspective. So it is 11 o'clock. I'm willing to stay and answer questions. Tim, are you as well?
Sure, absolutely. Yeah.
Okay, so that is the content. Thank you for joining us, and we're happy to stay on and answer specific questions for you.
You've had some great questions. Good interaction. What else?
This is Mike Brown. It seems, what is one of the things that's difficult to do is to try to instill in some businesses, if you're working with multiple businesses like hotels and things like that, to tell them they need to do this program. Otherwise, they could have some problems. And if they have a problem, they find somebody that gets the disease in their facility, it's going to hurt them and hurt the city. And I mean, there's ramifications are kind of endless. How do you communicate that effectively? You know what I'm saying?
There are two things that we've been saying, and then Tim, if there are other things, but they're not going to be checked on by the state, the county, or the city unless customers complain.
Okay.
That's what's driving it, is customer reaction and customer complaint. So, and there's been some research done by California Tourism, I think it's California Tourism, that people don't feel comfortable going out unless they know that things have been sanitized and those measures are being taken.
Exactly.
And so they may not do it, but their customer base may recognize that. I tend to not be a very scared person as it relates to viruses. I'm kind of I'm on that side of the spectrum, and I've gone to gas stations and I'm like, okay, where's your hand pump? You still have like food sitting out that anyone can touch. And even I was like, I'm not coming back here. And so that customer reaction and that negative piece from the customer piece, I would really highlight. And then the fact that our businesses are just as responsible for transmission as individuals are. Tim, do you want to add anything to that?
No, I think you nailed it. I mean, that we haven't really heard of any, of the health officials or coming in and doing inspections, but we have heard of plenty of customers. I think those are that's where it's going to come from if anyone has an issue and sees something that they don't think is particularly safe.
Great.
And Mike, what I've been doing with the ones that have reached out to us at the chamber or that I've connected with is really emphasize that one, the culture has changed and people are paying attention, and the businesses that they go back to are the ones that they see protecting them. So that's just, it's going to hit your bottom line if you don't do it. But the other thing I've been emphasizing is you will be liable if someone catches COVID from your lack of not doing these things.
Yes.
And so I've really focused on that side of it because there's not enough people to do enforcement.
Yeah.
And even when people complain, I mean, they're going to, at least at the city, they're going to get a letter from Annette saying people aren't wearing masks. But, so really just focusing on it will hit, if someone gets it, it will hit you hard. And so focusing on that scare tactic almost.
Can I chime in here on something?
Yeah.
I've been talking to another fitness owner in town, and she's already done this. I haven't done it yet, but if there's any other fitness people on the call today, I'm actually going to draw up a COVID-19 additional waiver for clients. She sent me something she found online. I'm probably going to tweak it. I already have waivers on all my clients, and they've always been discouraged to come in if they're sick. But I think that's something I'm going to do as an extra measure, that they have to sign it, agreeing that to these conditions, and just
that's a great idea.
thought someone else might want to do if it's appropriate for your business.
No, that's great. Joyce,
you can see in the chat, if you joined after I posted the PowerPoint, you're not going to see it, so I just uploaded it again.
oh, thanks, Debbie.
Thank you.
Yeah, you just click the download button, and that should take care of it for you.
I have a question. I just want to confirm that dance studio falls under the gym facility opening, and those are the requirements that we follow?
Yes, and I did have a conversation with the county on that on Friday, because there are a couple of industry scenarios that it's kind of unsure about. And he said that things like dance studios, in the county's opinion, would fit under fitness. If you are like a dance studio that has summer day camps, then you're going to want to take a look at the day camp guidance as well, and how to handle groups of campers all day.
Okay, thank you.
You're welcome.
Hi, this is Whitney Bain again. I just wanted to ask, just to make sure I understand clearly, I understand that the city of Vallejo requires masks at this point. So like for us, the dance studio, I think that would probably keep people from coming at this point, because to dance with a mask on, it just would be nearly impossible for a long period of time. So I guess my question is, if anyone on this call has any idea when that may change to being encouraged but not required in regards to the mask in the city of Vallejo.
Annette, are you still on the call?
I think she had to go to another call. She had texted me. Yeah.
Okay, so I'll share what I was on a meeting with the city last week, and what I was told, because I work with a lot of bar owners, and so the question was, are we supposed to tell people they got to put their mask on in between drinks? And what the city's response to that was, they only have to wear masks indoors if they're within 6 feet of each other. So I don't know, Whitney, if all of your people are constantly together, or if you can space them out 6 feet. If they're 6 feet apart, then they don't have to wear the mask. It's with it's when you can't avoid being within 6 feet of each other inside of the building.
Okay, thank you. That's actually really helpful. Yeah, our plan is to distance people and minimize how many people we even allow in the studio, and we're going to take any partnered activities off of the schedule completely.
And
so
that's what they told us to do in the bar situation as well, and the restaurant situation.
And Whitney, I'm not in Vallejo, but I have a very small studio, and spacing the people really does help. And that's one alternative I gave people, even though it's not mandated by state. At personal training, it says you must if you're doing close contact. But one alternative I gave clients in my newsletter was you could, and I understand some other yoga studios are doing this, and even a trainer in LA I follow. They're instructing their clients to, you could wear your mask upon entering the facility, get into your workout space, take off the mask, then upon leaving, put it back on. And I'm sure that has something to do with being close to people as you're walking. But,
yeah, that's what I was actually going to suggest, and there is some guidance that that supports that. Let's see if I can find it.
Okay, thank you, everyone. That's really helpful, because we've had a lot of questions. We want to make sure we do this right. So thank you so much.
Absolutely. Any other questions?
Tina, thank you for being on. I didn't see you when we first started, but
It took me a minute to get the login info. Sorry about that.
No, no problem. Glad you joined us. Thanks for partnering with us on this.
Tina, I hope you don't mind I changed your name because you came in as Tim Murrill.
Oh,
Yes, you did.
no, I never change. I never mind.
Okay. The other thing to think about too is you can use visual cues for the physical distancing piece in fitness centers. So, and you'll have to determine if this fits for your particular facility, but maybe you have signs or markings on the floor, like you can see behind me. We put tape like 6 feet apart from things. So there are some things like that, visual cues that you can use as well. Okay. And here's the pieces around, oh, whoopsie, the pieces around the fitness. Any other questions? All right, Tim?
Right. No, that will do it. Thank you again for being on. Hopefully you received some information that was helpful, and know that we are here for you. After this call, if other questions pop up, I put our phone number for the SBDC in the chat, and reach out to us on that number or email. We're here for you to help you get going again, and we wish you all the best of success as you restart this thing, and we'll be available for you. Thanks again for being on.
And we have been recording this, so we will be posting this on the SBDC website. So if there are other people that you think could benefit from it, feel free to share it with them.
Yeah, great point. All right. Have a great Monday, everyone. Thank you.